Well, I am Tammy Edward. Welcome to Own Your Wellness podcast. This podcast was started because I wanted to share options out there to take charge of our health. I believe our bodies are constantly communicating with us, and that so many health struggles come from just really not knowing that there's more information out there. So, this podcast is learning from wellness experts. Today's guest is one that I've been looking forward to talking to. She is a chiropractor who specializes in prenatal and pregnancy care, infant care, and who knew that that was a specialty for chiropractic? But if you've ever known somebody who had babies or you grew your own human inside of you, we all know that this is a season that really demands a lot of our bodies, and it leaves us usually with more questions than answers. So please help me welcome our beautiful guest, Kristin. I'm so excited for this conversation, Kristin. Thank you for coming to the show. First of all, just tell us a little bit about your specialty and what you do.
Awesome. Well, thank you so much for having me. I'm so pleased to be a guest, and I'm really looking forward to connecting with you and your community because I feel like I get the benefit of being on both ends of that situation you were describing. Because when I started growing my own tiny humans, I felt really discontented with the system that is in place to bring babies into the world. And then when I was struggling with my own newborns at home, it felt very alone. And I really felt like people were telling me, oh, this is normal. This is normal. And I kept thinking, if this is normal, how are we all still having babies and doing this? And I felt like there's got to be a better way. And so that really brought me into my specialty in my career. So as a chiropractor, I began learning the Webster Technique, and that is a specialized technique that we use during pregnancy. It is to really help align the mom's body and pelvis, her balance, her nervous system, so that she can have the best opportunities throughout her pregnancy and through her labor and delivery experience. Those are techniques that we use that help just reduce myofascial tension and ease some of the symptoms that come along with pregnancy. So that also can help ease some intrauterine strain that might be impacting baby's ability to get into the optimal position. And that's where we can sometimes assist with labor and delivery. But then also, once babies come out, they have gone through that same trauma that the moms have gone through, only it's happening for them across pressures of their spine. And whether it is a belly birth or a vaginal delivery, those kiddos come out with some strain to the spine, and we can reduce a lot of that. And so that's just like in a healthy situation. But there are also moments where our moms and our babies are struggling in that postpartum phase, nursing, latching, constipation, ear infections, colic. When babies come out, a regulated nervous system should eat, sleep, and poop. And if we're having difficulties with any of those things, there are people that can help. And I was able to study a lot through the ICPA, which is a chiropractic pediatric organization, and their education platforms are tremendous. It's an extensive amount of information, and then help them through developmental milestones. That's what's behind my passion there of treating those little kiddos, because I went through that experience with my own, and it was rough and it felt very alone. There is a community out there, and I wish I found it before I started my journey. And so I'm really excited to be able to share those resources with families.
I remember the very first time I met you, I was partnered with an acupuncturist at the time, and she brought me to a health fair where she knew you. She introduced me to you, but what I saw that day was very impressive because you had a lot of guests come to your table, your booth, and a lot of pregnant moms. And I saw that you gave them a lot of information and comfort, reassurance. So, how do you reassure new mommies that this is something that's going to be more beneficial and less risky?
Yeah, I think knowledge is power. And there is a lot that if we just understood our bodies and what is naturally occurring a little bit better, we would feel like we can approach these things from a less fearful place. And there's a lot of fear in the obstetric and labor delivery world. And I get it, those hospitals see the worst situations. But giving moms options and letting them know resources, even the things that are outside of my scope, encouraging them to find a midwife, find a doula. If they have questions, go for that lactation consultant, speak to somebody, because sometimes what I find is told, again, this is normal. It might be common, but that it doesn't have to be normal. When there are people who wonder why chiropractic, or they're afraid that we're going to come in and crack bones, it's not all like that. The chiropractic technique is an art, and so you're going to find practitioners that practice all sorts of different methods and techniques. And my job is to find what works for your body and help you to those resources. But I am very accustomed to having to put people at ease. The way that we adjust babies is a completely opposite end of the spectrum. It's, if you want to imagine the amount of pressure you would use to check a ripe stone fruit, right? We're like squeezing peaches here, right? It's not a lot of pressure. It's not force. It's very gentle. With the kiddos, we're looking at a nervous system that is primed to respond, and sometimes just encourage a movement by stimulating a simple pathway.
You specialize in both pregnant women and infants. So I know you have a very special story that I really am excited for you to share because I related to it. But before you share the story about infants and how you can help newborns, why would a pregnant woman consider chiropractic care while during her pregnancy? Can you just name some of the benefits?
Sure. The biggest one I would say is nervous system regulation. I think that eases pregnancy and helps with labor and delivery in the long run. Even if you're not having aches and pains, but there are a lot of just soreness, headaches. There's inflammation. There's bloating. We get lower pelvic floor tension. There are a lot of changes happening to your body in a very short amount of time. Your whole center of gravity shifts momentarily. And then you go from all of this lower body shift weight bearing to you're going to be carrying a baby upper body shift weight bearing. And it's a lot of strain on the body. And then you get into all of this lovely, admiring your adoring little human, and that can create its own neck and shoulder tension. There's just a lot of physical stress, and we can help ease that. We can help minimize some of it.
That's such a good way to picture how your body truly is changing. Is there a myth or fact about maybe how it could help with labor and delivery, your postpartum recovery? Are those benefits?
I'm a little biased, but I will say, yeah, I believe that the benefit. There are a lot of resources actually. So when people want to have a little bit more of that evidence-based research, that is all information that I love to refer to the ICPA website. It's icpaforkids.com, and they have all of their research available. And as a practitioner through their program, we're all encouraged to submit our own case studies as we're treating these populations so that we can all be seeing and discussing trends and really staying in front of all of this information as you're watching medicine evolve so rapidly.
That's a great resource. I'm definitely going to include that in the notes of this podcast, the ICPA website that you mentioned. So that's for anybody looking for evidence-based information on if chiropractic is for them. So you're in the Conejo Valley, Southern California. And what makes you different is you specialize in pregnancy, infant care. Would you say that that is definitely a specialty? So if somebody has a chiropractor that they're used to going to and they become pregnant, are there certain things they should look for or know as a
I
pregnant?
would say it's pretty important to find somebody who is practicing a Webster technique, or at least respecting and acknowledging the changes that are going on in the body, why there are certain moves that we may or may not use during certain times. But most chiropractors have understanding and awareness of these changes, and not being Webster certified does not make you a non-pregnancy practitioner. But if you've built a relationship with your chiropractor, I think that's valuable and it's important. And so, unless they said, I really don't do pregnancy, or you've started to feel uncomfortable, or like your routine of care didn't change at all, because it kind of should. When your body's going through all those changes, it shouldn't always be the exact same adjustment throughout. Then those would be moments for like, absolutely, come and find us. And I do have patients who come and they come just during pregnancy. And we have people who come and they realize the benefit for their body and they decide that it is part of their regular wellness routine. We are here also for pain management, but if you're really coming for pain management, your visits over the year actually probably would be the same as if you averaged them out once a month, and maybe we wouldn't have had that episode. Who knows?
Oh, good to know. These are great things to know for women who are searching. They can focus on the Webster Technique and the ICPA. Now, so lead us now, because I remember being a first-time mom. I was furious at all other moms who never told me the challenges of breastfeeding. It's like, why didn't anybody talk about how difficult it could be emotionally, physically, mentally? Like, what am I doing wrong? We have the honor of being part of a wellness community in the Conejo Valley. So a quick little plug: if you are a practitioner, a wellness provider in the Conejo Valley or surrounding area, we have a community for other wellness providers to plug into, and we connect with the Conejo Valley wellness community. We get to know each other, the specialties. That was just a quick plug, but you told a really beautiful story, and I wished so bad I knew there was even this option, because you had a mom who came to you with a newborn baby, and she was having problems breastfeeding. Can you tell us why a mom who is probably so stressed out, has no idea what to do, she's doubting her abilities, she has no time, she's sleep deprived, what are the benefits of bringing a newborn baby to you?
This story is really dear to me because this is where I really struggled with my own, my second daughter at home. It feels like once you have that baby, you just assume baby's out, everything else is going to go according to plan. And heaven forbid, we have some issues where baby's not latching very well, and we're having signs of colic, fussiness, doctors stress you out about weight loss, weight gain, jaundice, this and that. And you're expected to drag yourself out of your home to come to well baby visits and then go to your own well visits and all of this. And I really feel like that moment when you have just brought that new arrival in is so valuable to settle into what, like, your bubble. It is a lot. And so what I offer for my newborns is a home visit, which is a great way for us to just not interrupt that whole period. Come to the moms. A lot of our doula community is very in tune to the importance of this in-home care. And so that's where I was like, oh my gosh, why didn't I know these people were here? Well, I didn't ever talk to a doula. I didn't ever ask a midwife, right? We were just doing what the system said to do. And so this poor mom was struggling, and it was starting to lead to mastitis. So she's getting a breast infection because she's not able to be completely expressing breast milk. The baby is struggling and frustrated because they are getting a small latch. They were clicking and getting dribbling and then popping off and gasping and feeling. The mom kept saying, oh, I feel like I'm waterboarding my baby. My letdown must be too much. And oh, this boob over here, this is like my low functioning guy. This one doesn't produce as much. And those are the things you hear that are the common, but not normal. And you're like, okay, yes, but feeling like the whole time your baby's just choking and gagging, not normal. Those little sounds and those moments where baby is gasping for air, those are indicators that we don't have coordination of that suck, swallow, breathe pattern, which is one of those innate reflexes that starts to pattern in, and it is going to feed into chew, swallow, breathe. And that's going to prevent choke risks when we're toddlers and in adulthood. So all of these are signs that we want to work on the nervous system to help better function and regulation of the airway. And so when I was able to come into that home, I was able to assess that baby's upper cervical spine, do a little gentle adjusting on her occiput, and work through the cranial bones. We released some tension in the mouth and through all these little oral facial structures. We were able to then, in their home, in their comfortable space, latch that baby and get nursing going in a way that the mom was able to actually relieve and relax. That baby stayed latched, but it was an experience that I then didn't have to interrupt by saying, "Great, now your visit's over. Please get out of my office. I have somebody waiting to come in for their care." It was a moment where I got to leave them in their space, in their bubble, doing their thing. And I got to remove myself. So that was amazing to be able to do that for somebody else, because it's made me well up. The moments that I felt like I was sitting there trying to understand what was wrong with me when I was going through that. That's part of where I think we could just be supporting our moms so much better. And
Mm-hmm.
having a community like that, wellness community, that those are the people, that's the tribe.
Aw, you made me get all
Sorry.
You know what I heard?
Emotional.
You described everything so well. I mean, my kids are 20 and 23, but it made me remember so well. But what I did hear, something that stood out to me, was you said you had problems with your second baby.
Yes.
Some people think, maybe this is just for first timers.
No.
But your second baby, you went through it already, but just because you went through it, every baby is different, every pregnancy
Yes.
is different. And so you still could have benefited. And I know some people are having, 3, 4, 5 babies. God bless them
Yes.
for all that they're bringing into this world. Ironically, my next guest on the show will be a doula.
Yeah.
Who you and I both know, Mary Skinner. She's so well known in this community. And I think, I'll save this for when it's her time, but because you mentioned it's good to talk to a doula, that's just another example of, I probably would have thought that was a little woo woo for me.
Mm-hmm.
The hospital is going to know, everything that I need to know. I definitely would have done things differently. I think the trends are definitely leading us more towards more natural, which I love to see, or just more informed. And so that just gets to the heart, really, of why I
Yeah.
just started this podcast, was just so people knew that they had options. Like you said, we get thrown into this system and we think, oh, the system's got us. And how nice it would have been to really think that it was an option for me.
And it is wonderful to find your people and to try to find a different way and to really let your pregnancy experience be your own. It doesn't have to be what your friends did. It doesn't have to be what you did the first time, but being able to really tune into what you and your baby need in that moment and lean into that. I think that's what we can really
Thank you.
protect.
One last thing, I'd love to just hear your description, because as a reflexologist, one of the benefits is regulating that nervous system.
Yeah.
And, when I hear myself say it, it feels a little cliche. So I would love, in your words, to talk about the benefits of bringing down that nervous system. Like, how does that play out in the role of a mother or as an infant? How does that play out when you work with the nervous system? Can you just explain that in layman's terms?
Yeah. So like the
Flung
nervous
this question
system.
on you. Sorry.
No, you're great. You're great. Like the nervous system it's everything, right? It is how your body is regulating everything. We get used to this high stress world and we get accustomed to feeling like when we're go, 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 that's the best. And that's when we're productive. And that's almost something that people aspire to. and our bodies will adapt. We regulate. And so we rise to the occasion. And that means that your body gets used to operating at this baseline level of stress. And when we are doing that, we are so peaked that it doesn't take much to tip us over, right? And so little stresses become so magnified when our body is already completely facilitated. It is already maxed out. It's not healthy for your body to have cortisol levels like that and to be sleep deprived, because that impacts your hormones. And so the physical cascade of that stress response all the time is valuable to look at and to see where we can protect and balance that system a little bit better. And I think that a lot of people believe that regulating your nervous system, or, doctors always say, oh, it'd be great, just stress less. And you're like, cool. What does that look like? How exactly do I stress less? And it's a little bit of stress management techniques. It could be movement, it could be fitness, it could be breath work, it could be meditation. It doesn't look the same for everybody. Those moments help your nervous system quiet all the extra background fuzz. And then you are more capable of making clear-headed decisions. You can move with focus. I think that if we were all a little bit more regulated, we could all function a little bit better with our babies. Again, that function looks like eating, sleeping, and pooping. They should be
Yes.
regulated. It
We
should
need
be
them to eat, sleep, and
rhythmic.
poop. Yes, that's their
Yes,
job as a
you watch them
baby.
develop their milestones. They learn how to roll. They figure out how to lift and control their heads. They learn how to roll. They learn how to sit up and then crawl. These are all processes of your body wiring in. And if we've got stress in the system, the body's not able to wire in those patterns, and we get hung up on something that should be just a simple, basic movement. And now we've got background fuzz where your brain, their little brains, developing bodies, are so caught up in just how we do motor skills that they can't get to the things that make them develop their personality and control their behavior and learn how to, filter out some of the stimulus, right? And so all of that higher processing, it happens when our body is calm and self-regulated. If your body is busy just trying to stay alive and function, then we can't think properly.
I love this because chiropractic is one way to bring that to the body. So chiropractic is such a good tool for them, and it's so simple and easy. It's not cranking of their bones. So thank you so much.
Yeah.
I could tell you're very, very passionate. I'm so glad you shared your experience. And I want to say thank you for listening to Own Your Wellness. Real quick, Kristin, tell us where we can find you. Where can people find you? And I would love to include this in the show notes as well.
Oh, sure. So I'm in Newbury Park. Our my office is called Body Restoration. We're a wellness center here, so we offer a lot of different services. Don't be confused when you get to our website. And we have another fitness facility in Moore Park, California. I travel throughout Ventura County, and you can also find me on Instagram at Lagree Doctor at BRC_Lagree_.
Can you pronounce your last name? How do you say it?
Beierle. Yeah.
Beierle. Okay. I was dodging it, so I didn't say it.
Yeah. I just go by Dr. Kristin. They wouldn't get all formal.
Okay. Okay, perfect. Well, thank you. So if you have found value here, please share this episode with someone you know who is pregnant or wants to get pregnant or knows somebody who's pregnant. And even for women my age who may be very soon embracing grandparenthood. You want your kids to know the benefits of chiropractic. So because knowledge creates choices, and these choices, if we know we have choices, they create the change that we can take ownership of our wellness. So that's it for today. Thank you so much, Kristin. You guys make
Thank
sure
you
to
for
check out the
having
show
me.
notes. Thank you. All right, take care. Bye-bye.
Thank you.